want to talk about the celebrity piece a little bit.
Sure.
We were talking before we started recording, and, you know, for as many disasters that we see very publicly, which I do like to always preface this part of the conversation by saying, like, these people are under such intense pressure and scrutiny that I feel for them so much. And I think people are so quick to judge, and, you know, I see picture or comments on pictures of people and just tearing them apart. And then if they don't do anything, they're torn apart for aging.
Correct.
And so they're in an impossible position.
Correct.
But unfortunately, there are some pretty bad outcomes out there. And then conversely, we're seeing some pretty good outcomes
some
recently.
turnarounds. Yeah.
All the videos online are like, who is this new doctor in town? Because some of these women look incredible.
Absolutely.
So let's just delve into that, into the good and the bad.
So to avoid the scrutiny for like the shaming of celebrities, which
Yes.
I know there's some of that.
Yeah.
I don't think the celebrities have that burden at all. Zero. I would 100% blame the practitioners. Right. I think it's our fault as an industry. We should know better. And so I think if we'll look at Lindsay Lohan as the example recently. She's all over the place. People are showing me her picture, like, how is this possible? And going back to what I said in terms of the things I would ban, here's a kind of a step-by-step way to break down on a celebrity's face to see what happened, whether it went right or wrong. Look at their temples, and you'll watch, and if you measure the distance, right, from the little corner of the eye out, it should match the width of the eye. That's a simple way to look at it. It's a rule called 5 eyes. There was a TikTok filter that broke it down into 20 not too long ago as well. But you can watch, they all get a little bit wider here, and that's appropriate. So if you look at young, attractive, like supermodels that have never been touched, they all have width here, 100% without exception. Number 2, they got their folds back here. So with Lindsay Lohan in particular, I remember somebody showed it to me probably within the last week, so it's very fresh on my mind. They dissolved this filler here, which is what if I have a female client who I'm treating and feminizing and making look themselves again, step 1 is for me to dissolve all filler here. And it's very stressful for them because even though they trust you, they see exactly what made them afraid and came in. And so there has to be a lot of trust established. And I've learned to not do it all at once. So I do some, and then I also lift, and I help. So I ease that impact.
Lift. How do we lift?
Yeah.
What was that?
Up here. That's the
temple filler?
the temples and the skin tightening.
God, I need that.
It's my favorite. It's my favorite and least favorite. It's kind of uncomfortable, makes you a little sore. I do a lot with Sculptra. Okay. And so it's long lasting, and it builds your own collagen.
Do I need that?
I'll answer
I'm putting
directly.
you on the spot. Okay.
I can show you.
You can be honest.
I would say a bit.
Okay.
But here's the risk. People build temples the wrong shape. So just like we went through this age of, maleficent cheeks, we're going to go through an age of too much temples and too forward. But our rationales are right. They're just not accurate. So there's the big technique in our world that is you treat in a certain place. You want to do it for safety, but also you want to use as few syringes as possible and show a difference. I disagree with that concept in general. I feel like if you're actually aging and the person's not 25 and perfect, you shouldn't see a big difference with one syringe because it tells me you're using it in the wrong place. So anyway, I think that the point is, and the reason why women wear eye makeup and there's the shadowing is there's a natural absence here that's missing. It's kind of like a C. And then the volume goes back even further. Right now, the new fad is to put filler right up here. It's making people wider, but it's also making them look a little ethnically inappropriate.
Okay.
So, but yeah, temples is number 1. But getting back to celebrities, we'll go through look here. Okay. So look for the width and look for the cheek no longer sticking out. So we think we want cheek contour, which is true. We do, but we want flatness here. We don't want a mound here. And I always say makeup artists get it right more than injectors. So when they put a color here, they're going to put light here and they're going to flatten it and they're going to get light reflection here. I think we got confused. So getting back to the truth in the trend, it's something and it's just the way my brain works. I love to understand. I don't assume they did it intentionally wrong. I like to understand how did smart people who meant well get it wrong? So how did we go down this nasolabial fold trend, right? Ever from the very beginning. If I think it's wrong, how did really smart people do a lot of it? Well, I think it's because we forgot about the picture and we were just narrowly focused on the eyes. The fullness here, it's 100% attractive when you're smiling. So when you smile, you should have a mound here. So we got confused at static. We shouldn't have a mound there. And so if you have a mound here at rest, and then you dynamically smile and you have a bigger mound, we start seeing all these closed eyes. It's one of the things I like to do on stage. If I'm doing a live correction, I love to take this part out and you watch their eyes open up again. Because it was probably never there. Mm-hmm. But we are, I think providers, without saying it, we have this, it's challenging dealing with patients because they're like, I want to see a difference. I want to see a difference. I hate this, and I can only spend this much. And so if I need to make a difference in the nasolabial fold, right, I have to show a difference right away. And I put filler right here in somebody who was flat always, and they haven't aged, and I put it in a place it shouldn't have been, they're going to see a big improvement. They're going to see a big change, rather, not a big improvement. Mm-hmm. Going to make the line that they hate look better, but little by little, because we know that fillers don't go away the way we used to say they did, you start to see this accumulate. And then when people smile, there's a lot of scrutiny on celebrities with the eye. I think, a lot of harsh comments about celebrities with, under eye filler, or these cheeks that kind of get out of control, mm-hmm. or the old people who got beat up so much about it, they've almost opted out of all treatments and mm-hmm. it ruined their life, and all these like very, probably accurate and egregious statements, right? So I think look temples, make sure their cheeks don't stick out too much past their temples. Mm-hmm. And we don't want cheek contour in the back, which is, I think, another misconception. Mm-hmm. We do want cheek contour up here in the anterior, the forward part of our cheek, but not all the way to the end. And then we want a smooth contour. We talked a lot about masseter beforehand. Mm-hmm. The smooth contour between the cheek arch and the angle. And so it's one of those things we sometimes get wrong. If I take the whole masseter down and I get a big drop off back here, and I need confirmation, I need instant gratification when I look in the mirror and I see this drop down, I see it and it makes me happy. It also makes me look a bit older. Mm-hmm. And so there's that constant. I joke with a lot of my patients. I say I only have two types of patients, neurotic mm-hmm. and super neurotic. Yeah. And so it's a game of managing that probably as much as understanding how to do the right treatments. Mm-hmm.
Yeah. I have some friends who are plastic surgeons and they mm-hmm. say the same. They are dealing with some
intense personalities.
Yeah. It's searching for the right word.
Mm-hmm. Yeah. And I think there is a line which we don't talk about enough that is probably unhealthy, right? That we probably shouldn't treat them. And there's a level of delusion that probably needs real help. Mm-hmm. Up to that line, I think of those people as kind of enthusiastic, or just, I feel like a lot of them are very goal oriented. They just want to look and feel their best. And so I feel like to the extent we can, I want to help them do that, assuming we can follow protocol that I don't think they're trading something that they wouldn't be happy to trade mm-hmm. later. Mm-hmm.